Our community leaders are working hard to communicate to the public the things that we need to know during this coronavirus outbreak and about how it's going to affect us on a personal day-to-day basis. I got a chance to talk to Bill Crampton, who is the public health nursing supervisor. He's also one of the incident commanders during this coronavirus outbreak. And I got to talk to Cody Mayor Matt Hall about local services and also about what to do if we do fall ill. When it comes to public health, Bill Crampton, Park County Public Health Nursing Supervisor, is one of the incident commanders for dealing with COVID-19 related issues. He explained what to be on the lookout for if you start to feel unwell.
Well, the common questions or symptoms that we're looking at are cough, fever, and shortness of breath. Okay, those are the three biggies. The shortness of breath thing, I think, is the one that everybody should pay more attention to, because this research and everybody's talking about the fact that you just can't catch your breath. And it, as a side effect, it leaves you tired. As a side effect, it leaves you logy and not wanting to eat, not wanting to drink fluids, which are all the things you really need to stay on top of. So of all of the things, and it's not to say that your asthma isn't being kicked off by this. Your COPD, you're having a relapse. It's not to say that your other, congestive heart failure or other things are not being affected by this as well. And folks with those diseases, we're really concerned about, and that's why we're really working to keep them at home and try to provide services to them by knocking on the door and delivering food and picking up their medications for them. We've already done the thing with Matitsi, where some people down there didn't have a way to come up here and avoid being exposed to pick up medications. We've been talking to the pharmacies, so there's deliveries being set up. Contact your pharmacy. Make sure that if a family member is picking up your medication, you're on the list at the pharmacy so that the pharmacy can identify you. And we've got a number of other procedures in effect to help folks get their medications. I know that there's the question about the supply chain from, China, because some medications or their ingredients are being produced or supplied by China. I haven't heard anything of the common blood pressure things. Some of them more, I don't want to say exotic, but the ones that are less frequently used may end up becoming a supply problem, but right now I've not heard of anything.
One of the many questions people have had is, when do you go to the hospital? At what point do you determine that you're sick enough to call the doctor?
If you've got a broken leg, a laceration that's pretty significant, those kinds of things, that's a given. The respiratory thing is you really can't catch your breath. You really are struggling with chest pain, coughing horrifically, and you got a fever that doesn't respond. Those are the kinds of things, call ahead so they can prepare for you, that you should go to the hospital and be checked out for. We're working on things like oxygen concentrators with our various suppliers to have more available so that if we send somebody home that just needs a little support, that oxygen concentrator or a few tanks of oxygen may be what helps them get over the hump rather than being admitted to the hospital.
But Bill points out that even if someone exhibits symptoms of COVID-19, that doesn't mean they'll be tested for the virus.
Because there's a limited number and we're running out of viral transport media and the swabs, we're kind of trying to catch that up right now through the supply chains.
So that's what you need right now?
Yeah, we need a lot of that. And, at this point, it sounds mean, but we're collecting data. We're trying to get answers through those tests. And unfortunately, because we've had the backlog, the tests aren't providing the physicians, for the most part, the best clinical guidelines. They're using their clinical judgment. Remember, this disease we only have supportive therapy, oxygen, other medications to try to reduce inflammation, things like that. And if you're in the hospital, you're being monitored by somebody, and nursing staff and such. But for the most part, this is more serious than the common cold, but its treatment many times for a lot of folks is the exact same. Home, rest, don't expose yourself, take whatever your favorite fever reducer is.
However, Bill pointed out that there are some pieces of misinformation or unverified information that have made the rounds on social media. For example, the concern about whether or not ibuprofen will help or hurt patients who have COVID-19.
There's a lot of things out there that are in the misinformation universe. We don't have a good study that says one way or the other. Now, at the same time, we're all individual human beings. So maybe ibuprofen causes a problem for one person and doesn't cause a problem for the next person. We just don't have any research on that.
Meanwhile, at City Hall, Mayor Matt Hall explains that most city services are still being provided.
We've closed all of our buildings to the public, but we can still accept bill payments via online, telephone, or of course our Dropbox, and so pretty much all the frontline staff is still pretty busy. The rec center, even though it's closed, we've asked them to do their annual cleaning. So hopefully when things go back to normal, we won't have to take another week off in August for the rec center. Their building department is still, if you need to set up a like a inspection or a permitting or anything like that, they can be contacted via phone and set up an appointment with them. So we're trying to do everything we can to keep a lot of the basic interactions that people have to kind of keep things going. Of course, all of the main utilities are electrical, water, wastewater, garbage pickup, and of course law enforcement. All of those are going full bore as if nothing's really happening. We're trying to stagger those guys just in case any one of them gets sick or anything like that, so we have some backups to make sure a lot of those services don't go down, because we need power.
Yes.
It's hard to have a hospital and not have any electrical or water or anything like that. So
Absolutely.
So we're really concentrating on keeping those things going.
But because of the regulations eliminating public gatherings, Mayor Hall says council meetings and other public information sessions have to be modified.
So for now, we've canceled we canceled a couple of or at least our one work session between the end of this month. So our next council meeting isn't actually until April 6th. We have talked to the city attorney, and we're able to do some remote, we can have people either video or teleconference in. That's how they're going to at least do the planning and zoning meeting, I think, that's coming up. That's been a recommended, I think, from every level, really, is to try and do as much as you can remotely. And so we're taking that to heart. We'll see where we're kind of at in another week or 2 weeks, and if we're still in the same situation, then I could see maybe a couple of us being there, but then the rest being phone. And I know there's a few council members that have some family members that would fall into a higher risk kind of category. So I'm certainly not going to try and pressure them to come out.
Mayor Hall pointed out that significant efforts are being made to coordinate information locally as well as around the region.
We've talked to Mayor Wetzel in Powell. I've talked to Mayor Gill down in Worland. I talked to a few city council members in Jackson that are friends of mine. I think the network, at least as far as the local government's, pretty active. I think we're trying to come up with some solutions, trying to get the word out of where some of the businesses can go, tell some of the other mayors and communities, and even try and, if possible, if we can start to see some of the personal protective equipment supplies come in, and even if we have if there's some extra here or there or some ways, and then we can get those to maybe some of the other communities. But I think that that's the one great thing about being so connected is, I can pretty much do all of that, even really from my house, via phone and the internet. Actually, every afternoon we have a conference call that we all share, and that's actually with all the municipalities, most of the first responder agencies, the hospitals, and so it's just one area we can call in, get the updates, and at least try and have a nice similar message, but then all those organizations and what everyone's doing. So
Both Mayor Hall and Mr. Crampton agree that there is no way to tell how long this will last.
The testing isn't going to change anything for us. We can know all the tests in the world. What's going to work for us is how you take care of yourself when you're sick, and how well you follow the precautions that we've been talking about for a couple of weeks now. And that's the 6 foot space. You're just almost there. And
I'll stand back.
hand washing and things like that. Staying home when you're sick. Being honest with yourself. Calling the hospital if you feel like this is it, I can't handle it anymore, and advance preparation for that, because we just can't inundate the hospital. There are folks home recovering right now. Our first case is at home, and I've heard nothing negative about what is going on with that individual.
It's been everyone's frustration that these tests and not knowing if people have it or if they're sick or to what degree. I've heard a lot of different scenarios where if you have a case, what that supposedly mathematically you should have X amount more cases given some of the research that's been done. But we have no way of really kind of knowing per se. So really the best thing we can do is just to try and really get people to hunker down, to just, if they can, stay in their homes, continue just to take it easy, practice the social distancing when they do have to go out, but really take this seriously and do everything they can to follow what has been suggested to really lay low for the next couple weeks, or at least until the end of this month.
The community is doing a great job. Volunteers are everywhere. People are delivering food, picking up medications, doing all the things we're asking. But there's always going to be some that are missed. And I really hope that our volunteers and the people working on this spend some time overcoming their anxiety about visiting folks they're not sure about, and try to reach out to those folks too, so we don't miss anybody. This is Park County. We need to take care of our own, and we'll get what we get, but it's up to us to take care of our own.